and welcome to Health Show with Amara from our London studios. I'm Dr. Amara Sohail. Today, our topic is about mental health. And our guest today is Abigail Windsor, who is a manager of acute mental health team and leads the crisis team. She is an entrepreneur, a mother as well as a grandmother, although she doesn't look it. Originally from Zimbabwe, let's welcome Abigail Windsor. Hi Abigail, thank you very much for coming to our studios today to talk about mental health. First of all, before we talk about mental health, if you could tell us about your journey from Zimbabwe to UK.
Thank you so much, Dr. Amara. Yes, so my journey from Zimbabwe, I basically came to the UK quite a few years ago now, around 2007. So before I came, when I came here, I already had my two children. I've got a boy and a girl. So when I came here, I had just done more in retail management. And so it was when I arrived here, the jobs, it was quite difficult to just do education without a job. So I happened to fall into restaurant business. So I was managing quite a huge restaurant business. And it was within that I started developing my personal passions because I saw so many young people who were distraught and, missing their families and they just didn't have anywhere to go. So with that, I really didn't know what to do with that, with myself. So I decided to, come on, in the UK, you can study anything you want. It's your energy. So I went to study theology. So I actually studied theology in biblical studies. I did a specialist pathway in Islam. So I also studied Islam and I studied other major religions and social anthropology. So I think through that study, I developed such love for humanity and love for people. I managed to travel to France. I went to Philadelphia. So I did see a lot of different cultural dynamics and how people view the world. And so that inspired me to think, let me go into a profession so that I can go into mental health or into something related to health. So I became a social worker. So I'm a social worker. I did masters in social work. And straight away as a student, I joined mental health services. And I've always been in mental health services since 2015. And since then, so now I'm working in the crisis team.
That's very interesting. So you mentioned that you studied various religions, including Islam, and then you traveled a lot.
Yes.
And the combination of studying religions, traveling, that inspired you to do something for the humanity, and you chose to become a social worker. Yes. That is amazing. So how did you end up in this crisis team, and what is your role in that?
So in the crisis team, I manage a 24-hour service. It's 365 days a year. It's quite a huge team. We've got a multidisciplinary team. And how I arrived in that, I did work in the community. Of course, as a student, I worked in the community. I explored. My dissertation was actually on cultural competence. Right. Because I was still interested in understanding the human being and understanding the cultural dynamics and behavior. So it interested me. So I just decided. So I did work in the community. I've worked with families directly as a care coordinator. I've also worked as a part-time in different services in England. And then recently, 2 years ago, I got a job in the crisis team where I work. And it's
tell
amazing.
us about that. What do you experience being a manager in the crisis team? What does your role involve and how busy you are?
Yeah, it is. I can say two things. It's either hectic, but I love the job and it's very fast paced, and the responsiveness is key. So what we in my role, I think it's about really using the transferable skills from my personal life experiences, managing people, because the team is quite big. As you can imagine, I run the night team, the day team. So I've got between 40 to 50 staff at a time. And we also run other like recovery houses. And so it's about managing the people who are experiencing the service users crisis as well as them. Okay. So it's actually, it's quite an interesting, complex responsibility and role. And then you've also got to manage the crisis itself, like the resolution. So here we call it crisis resolution and home treatment team. Okay. So what we actually do is we respond to a referral, which is someone who's in crisis. And it could have been a first episode presentation in a mental health illness. So when we see those people, we have to assess and then find out how best we work with that. As I mentioned earlier, we've worked with a multidisciplinary team. So we've got consultants, psychiatrists, psychologists, social workers, OTs. So it's a whole dynamics, and the nurses. So we try to resolve the problem by offering treatment and some support at home as well.
Okay. And you mentioned it's 365 days a year. That sounds busy to me. And with this rise in mental health problems amongst adults as well as children, do you see a lot of referrals with anyone in crisis on daily basis?
Yes, yeah. This is the part whereby every day is new. We've got different presentations. We get up to maybe, for one team, our team, we get maybe up to 15 referrals and sometimes even 20 referrals a day.
In one day?
Yes. So, yeah, we do. So, and everyone is individual. So people present with different crises. And the major one is mainly around family breakdown and lack of family support. And sometimes we get people we already know with the services, okay, who are no longer engaging or who are not taking their treatment seriously, and they are not really engaging. They stop taking the medication. And as you know, it's just not the medication which treats or resolves a crisis. So it's several other psychosocial aspects as well. So,
and what do you think, what is the reason why the number of such cases is going up? I mean, of course, COVID could be one thing, but besides COVID, what are the other reasons for that?
I think it's really, as a nation, shall I say, but I think it's really around drug control and drug use, misuse of drugs, and other behavioral issues. So we find that drugs and alcohol, they complicate mental health.
But are the drugs or alcohol are easily accessible to those who don't qualify, especially like underage or teenagers who shouldn't be on drugs? So how easy it is for them to get access to these things?
The underage, the main, I would say, I work in the adult services, so it's 18 and over, although I know that we work with those transitioning from the CAMS, the children, adolescents, mental health services. In most cases, from my personal view, I think it's mainly the family dynamics. I don't feel like there is this a strong community base anymore.
Why is that?
And
is it because everyone has to work because of the financial challenges? Most people in the household have to work, and therefore that family bonding is not almost non-existent, or
yeah, I would agree. It's mostly the standard of living is just extremely high, and parents are struggling, and the support systems, I feel they are not really adequate. Childcare is very expensive, so some families are left out with no choice really. So this is where the psychosocial dynamics are really the main cause. So about at least 90% of the people we are supporting, it's more psychosocial problems than the actual organic causes.
And neglect of children, young children.
Neglect,
so,
yeah.
And do you see there is a rise in the suicide or self-harm amongst young children?
Yes, there is actually, because it's also, so there is two conversations in that respect, whereby in secondary schools we see a rise. So it's peer pressure. Is it something fashionable? And the social media impact. So it's all such a complex arena to really look at. And then you realize that it also depends with the family backgrounds. So sometimes where the family is not very stable, we see a lot of that happening, self-harming children and young teenagers. Yeah.
And with your interest into various cultures, do you see that there is a difference or maybe there is a trend in these mental health problems in some communities more than others?
Yeah, absolutely. There is a definite difference. So, for example, like you might see that in more affluent areas where the families are earning a little bit better, like a medium earning, so there will be lesser mental health, like drug use, or maybe so there are some, and then there are some areas whereby definitely the children are most likely going to be affected.
But should it not be that those who are affluent, they can afford to buy drugs, it should be more accessible to them rather than those who can't afford? So how do they manage? Then they get into the other bad habits of stealing and that kind of stuff, you think?
I don't know. Yeah, it's well, we actually, you can actually see differences in presentations. So you find out that there are some areas you find most probably like what we would call like personality disorders. More
what
of
are the
that.
commonest types of mental health problems you deal with on day-to-day basis?
On day-to-day basis, the major one at the moment in the area where I'm working is drugs and alcohol and criminal behavior, which is so complex that because the police are not really responding on time, and then if someone has got a label of a mental illness, by default they end up inpatient, hospitalized, and the actual crime is not being resolved. And then you see the people in the bed, which I want to call the bed circles. So they end up, so there is that continuation of behavior rather than it being resolved. So there's something to do with the law.
So it can't be cured or treated because the problem remains the same despite the input from social services or police involvement. You can't actually get a person better?
No. In that case where law is concerned, it's quite difficult. It's a difficult dynamics, to actually. But we do have positive stories, obviously, like some people who present to mental health services, they engage. We go through psychoeducation, and we support the families. We introduce them to local carers associations. So we do support families.
But how easy it is for you to provide that kind of support? Because I know that nationally there is crisis, financial challenges in every department. So do you also have these constraints that result in like lack of resources to support such services, and people, even though they could have benefited, but they don't have access?
Yeah, the access is difficult. I think there is I mean, I think locally there are clear pathways of people getting access and how to get the access. It's about knowing. What I found out is most families do not know what they can get and when and what to access.
Right.
Sometimes it's delayed access, and sometimes it's the lack of, like I mentioned earlier, lack of engagement. And then, but if the family is already not very stable, I think it's also difficult for them. That's when they need a little bit of support. So the question now then calls on staffing within NHS, whether we can actually be able to support.
Of course. And like, do you see that immigrants, when they come to this country, their children, they are having this cultural differences. They're taught one thing at home, and they go to school, there is peer pressure, exposure to social media. They get confused, and that may result in their mental health problems?
Yes, absolutely, it does. It's so so you realize that they go through, it's acculturation, and there is so much of, sometimes they end up in cross marriages.
Yeah.
So there is such confusion which is happening, and there's some sort of feelings of neglect. Although the families, I'm sure they are trying their best to provide for their families when they migrate and come into the country. But I think there is that sense, and there is then this sense and demand, the need to work, and then they end up leaving the children unattended, and there is not really that support. For example, you would find in Zimbabwe, whereby you've got access to aunties, grandma, and there is really not an issue of childcare.
Absolutely.
So that kind of difference. So for me, I like to look at it from, it's not only the person who's presenting with mental health now, it is actually the whole family.
Yeah.
So the mother or the father would be going through their own difficulties.
So family dynamics has got
yeah.
a major impact on how children behave, or even any individual within the family unit behaves. So what do you tell, how do you encourage people to have that kind of bonding or improve their family dynamics? Because it is very difficult, especially when there is so much on social media. I think it, as you mentioned earlier, that it becomes fashionable when they see other people doing silly things. They think that it is very fashionable, and they do that as well. Running away from home, trying to be on their own, stealing things, getting into fights. So how can society improve?
Society, I think, the society at the moment is quite complex. I mean, looking back 50 years, it was, I think, so different. So I would say, what I would say is, when you identify there is distress or there is a problem in the family, families are just encouraged to get together, be together, love one another, love your children, spend the general holiday times together, Christmas, Easter, I think, and any other religious activities, and like festivals and cultural stuff. I think people should just enjoy and be family.
That's true, but that is at their personal level. What is government doing in order to involve youth into such activities, to encourage them to get involved with these positive things rather than getting into the bad habits and all that? What is the input from the government? Are there enough funds to support such activities?
I don't think there will be a time when we can say there are enough funds to do that. I mean, maybe that's a bigger, I couldn't answer that part, but I think I still maintain that there are services around, and it's about knowing. So it's about giving information. I think if you remember, in 2014, they introduced the Care Act 2014, which one of the principles is giving information to young people, to families, to everyone. And everyone has got a right for an assessment. So it's really about accessibility. So I encourage people, if you see any problem, seek the help. I think some people, there is a lot of stigma with mental health, and people don't want to be associated with a mental illness, and it's almost like a shame, and it's not really, because I've experienced quite really difficult situations with young families who've just gotten married, and for example, the female gets postnatal depression, and it's such a shock to the family.
Because they don't have an understanding of
they
this
don't
can
understand
happen and
this
how to manage it.
Yes, and they don't understand this thing. Sometimes they keep it, and then they come when it's too late. So all I can say is, just people should just come sooner than later, seek help, and things will, sometimes things can get better.
And do you think this, where you mentioned about these religious festivals, people should participate in them, how does it go with attempts to have this cultural integration so that there is less divide? People need to mix with each other in order to understand what are the cultural constraints or limitations, so that they don't then try and stigmatize or call them extremists when it comes to religious differences.
Yeah, so this is my passion, you see, of people becoming together. I think it's really more, we need to bring more awareness or it's all around love really. But we need to bring more awareness, more education in schools about different cultures, different dynamics, what other people respect.
But do you think that people have got more awareness because of the social media about each other's religion or cultures? And
the social media is good and bad, in my personal opinion. So it gives you what it wants to give you, and you can only access a little bit of it. So from where I stand, because I fully understand and appreciate how good somebody's worldview is, it's not the same information you would get from social media.
So most of the education should come from the family members.
Formal education.
Education in schools, but more so within
From
their
families.
homes as well.
Yes.
So that is very interesting. So what would you tell our viewers? What is the way forward? How can we improve the situation where there are more people dealing with mental health crisis? What would you say to them?
There is more people dealing with mental health crisis, and I would say seek help sooner than later. And I'm not a psychiatrist, but I believe that if you are not treated for a long time, it can only get worse. So, and then it is so difficult and complex to
they should not take it as a stigma, because
there is no stigma.
That needs to go. This concept that they will be stigmatized if they are actually diagnosed with a mental health problem, that should actually go. And they should not have any shame in coming forward to seek help.
It's mental illness is the same, it's just like any other illness, any other disease. So it's really important to come and also to engage. Once we've got so many success stories of people who've written books, people who've come back to us. In my unit, in my office, we've got loads of cards. Many cards saying thank you, because when the person presents, they are not very well, so sometimes they can be resistant to treatment. But after a while, when they are on the other side, we've got very lovely stories to tell.
That is very encouraging and reassuring, and we would like to share all those positive stories for people to learn from them. So thank you very much, Abigail. That was very insightful, and we appreciate your time. Thank you very much.
Thank you, Dr. Amara.
So viewers, you heard about Abigail's journey as well as the challenges she faced in her job that goes 365 days a year. But important message was that please do not shy away from seeking help, because with help she has seen several success stories where people have benefited from their support and care, and I'm sure there is a lot more we can learn from her in our future programs. So bye for now. We'll be back with another health show.